Diabetes research supported by NIDDK has led to many groundbreaking discoveries to help adults and youth prevent, delay, and manage this chronic disease. Hi, I'm Dr. Griffin Rodgers, Director of the National Institute of Diabetes, Digestive, and Kidney Diseases at the NIH. And joining me to talk about key studies and findings in our diabetes research and future efforts is my colleague, Dr. Christine Lee, Program Director and Project Scientist for the Diabetes Prevention Program Outcomes Study, also known as DPPOS, and the Rare and Atypical Diabetes Network, or RADIANT, within the Division of Diabetes, Endocrinology, and Metabolic Diseases at NIDDK, part of NIH. Before we cover some recent studies and findings, I'd like for you to talk about what is exciting and what you like about the diabetes research that you coordinate in NIDDK.
Well, thanks, Dr. Rodgers. It's a pleasure to be here with you today. The diabetes research that I help to oversee here at NIDDK comprises clinical studies focused on preventing and treating type 2 diabetes in adults. And what I find really exciting about it is watching the progression of research that happens from observational studies that get at finding those key risk factors for the development of diabetes, and then moving on to coming up with new treatments or therapies that target those risk factors to prevent or treat diabetes, and testing them in those clinical trials. And it doesn't even stop there. We have these special kind of trials called pragmatic trials that then, once they find an effective therapy, they study how best to implement it and roll it out broadly so that the people who need those therapies or those preventive strategies can benefit from them. So I think watching research progress so that we come up with those new ways of treating and preventing diabetes and getting them out to people who really need them is what I find most exciting here about the research at NIDDK.
Fantastic. The public and healthcare professionals are likely very familiar with NIDDK research in type 1 and type 2 diabetes. Are there current studies examining rare and atypical forms of diabetes?
Oh, most definitely. We've had a long history here at NIDDK of studying rare and other forms of diabetes besides type 1 and type 2 diabetes. I think at NIDDK, we care a lot about research that's going to improve the health and well-being of everybody with diabetes, not just the common forms like type 1 and type 2, but also these rare and less common forms of diabetes. We've had small clinical studies as well as large multi-site studies that have delved into these different forms. And some of the examples that we've uncovered are the diabetes that results or are associated with other kinds of diseases. Mm-hmm. So, for example, we have efforts focused on the diabetes that results from cystic fibrosis and from pancreatitis. Now, these other diseases can affect the pancreas, which is the key organ making the hormone insulin. And without insulin, people get diabetes. So those are been going on for a while and still ongoing. We also have efforts to get at a special kind of diabetes that develops during pregnancy, and we call that gestational diabetes. And we have ongoing efforts to figure out how best to diagnose gestational diabetes as well as to treat it for the health of the mother and the development of the baby. We also have efforts to focus on rare forms of diabetes. And these are diabetes that can result from defects in a person's genes, and typically run in families and can have an onset at an earlier age. And so there's been a variety of efforts. We call those MODI. And so, there's a lot of efforts those are just some examples of the many efforts that we've had so far. And we actually have a new, exciting new project called Radiant. You mentioned earlier the Rare and Atypical Diabetes Network. And this is a multi-site study that is trying to find people with new forms of rare and atypical diabetes and to study them so that we learn what makes them different and why, and help them better understand their disease, both for the patients that are struggling with these rare diseases, as well as their providers who are struggling to help them take care of their diabetes. Secondarily, we think that by understanding these extreme differences, we're going to get better insights into the spectrum, the broad spectrum that we're currently calling type 2 diabetes, because we know that our patients with type 2 diabetes are all different from each other. They're not, there's no one size fits all. So by studying the differences, we're hoping to get at a better understanding of even the common forms of diabetes like type 2 diabetes.
Excellent. Well, as we look forward to the future results from Radiant, let's talk about the landmark Diabetes Prevention Program, or the DPP. What have we learned from the DPP?
Oh, we've learned so much. This is an amazing study that started all the way back in 1997, before I even came to NIDDK. And the goal of the initial DPP study was to test whether or not an intensive lifestyle program focused on healthy eating, healthy diet, and increasing physical activity to lose weight, and also studying a drug, a very commonly used drug for type 2 diabetes called metformin, whether either of these could help to prevent the development of diabetes. And so they enrolled 3,234 adults with a high risk of developing diabetes across the country at 27 different sites. And some of these people got this drug metformin. Some of them got the lifestyle change program to help them lose weight. And some of them got a placebo pill that we know doesn't do much for preventing diabetes, but would be a comparison for these other groups. And then they followed them up to see who developed diabetes, and found, in fact, that lifestyle intervention was so effective that they stopped that trial early in 2001, because it lowered the rates of developing diabetes by 58%. And that metformin was also helpful for lowering the rate of developing diabetes by 31%. And the study group did additionally some cost-benefit analyses, and they found that the money spent and the effort spent on giving people the metformin or giving people lifestyle change programs was worth it to prevent diabetes. And that led to the CDC coming up with a national diabetes prevention program, and that developed a way of certifying lifestyle change programs all across the countries to help people with prediabetes benefit from this effective curriculum to make healthy changes in their lifestyle to prevent the development of diabetes. And most recently, CMS has rolled out the Medicare Diabetes Prevention Program, MDPP, that leverages these CDC and DPP programs so that Medicare beneficiaries who have prediabetes and are eligible for these diabetes prevention programs could get coverage for enrolling in them. And so that's a really good example of what I was talking about earlier with you, about how rewarding it is to see our research progress from a trial all the way out to bigger efforts to be disseminated more broadly for people who need them.
Excellent. Well, going back, you said its trial started in 1997, or actually ended early, and results were announced in 2001. Since the DPP, are there ongoing findings?
Yes, in fact, the study is still ongoing, and the participants that originally enrolled in DPP were invited to continue on in the DPPOS that you mentioned, the Diabetes Prevention Program Outcome Study. And we're continuing to see whether or not those treatments, the metformin and the intensive lifestyle change program, are going to have an effect for preventing other diseases. We know that people with diabetes are at a higher risk of developing complications of diabetes. And by complications, I mean they can get eye disease, diabetic retinopathy, they can get kidney disease, nerve damage, diabetes neuropathy, as well as diseases of the larger blood vessels and cardiovascular disease. So we're following them out to see if they develop any of these and if any of those strategies to prevent diabetes can work to prevent the diabetes complications too. We've also partnered with other institutes here at NIH, for example, the National Institutes on Aging, to study whether or not these strategies can promote healthy aging and prevent things like dementia as these people get older. We've partnered with the National Cancer Institute to see whether or not metformin can prevent cancers, and NHLBI to, as I mentioned before, see whether or not metformin can prevent cardiovascular disease. And so it is still ongoing. We don't have all the answers yet, but we do know during now going on for 20 plus years that the original interventions, the metformin and the lifestyle, are still working to prevent diabetes 10 years out, 15 years out. And we know that those people that enrolled in the study who didn't develop diabetes yet actually had less of those complications that I mentioned, those microvascular small vessel complications like eye disease and kidney disease. So those are some of the other findings that we've come up with during the DPPOS study, but I'm excited to see what else comes out from DPPOS because it is still going on.
No, absolutely. And talking about coming out, there have been numerous papers and results from this long-standing study. And can you talk about what specific guidance the DPP and then its follow-up study, DPPOS, have provided to different people at risk of diabetes?
Oh, yes. I think that DPP participants were very grateful for them volunteering for this study. And the DPP enrolled such a diverse population that it's ideal for coming up with, for using them to study them and coming up with specific recommendations for different people. So one example that I can think of based on results from both DPP and DPPOS, we know that people were enrolled at a broad range of ages. So they were ranged from age 25 all the way up to 85. And we know that by age, there were some different results. So older people actually had a greater benefit from the lifestyle intervention. So if they were 60 years of age or older in the beginning of the study, the lifestyle intervention lowered their rate of developing diabetes by 71%. That's much higher than what I said before for the whole group. And when we've looked at some of our other things, other disease processes that develop with aging in DPPOS, we found that that the lifestyle intervention actually lowered the likelihood of people becoming frail in older age. Wow. So I would say that the specific recommendation that's coming from some of these findings by leveraging the broad age range in the DPP study group is that if you are a person who has prediabetes and you get diagnosed after the age of 60, really the emphasis should be to find one of these NDPP programs near you and enroll in them, because the benefits of getting that lifestyle change program is not just to prevent diabetes, but it's also going to have benefits for healthy aging and avoiding frailty as you get older. So I think that's one of the specific recommendations I could make that comes from the results of our study. But as I said, it's a very diverse study population. We had 45% enrolled of race and ethnic minorities. We had men and women. So I think there are going to be more and more results that come out from this that are going to get at a little bit more tailored advice on how best to prevent diabetes for different people.
And just to highlight one of the points that you said, that it's people who were 60 or older when they got randomized in the trial had a 71% advantage in terms of preventing them developing diabetes. The take-home message there is, I guess, it's never too late to start.
No,
Yeah,
not at all.
that's remarkable. So with the broad range of research that you talked about, are there any research gaps or areas that you think could benefit from more research?
Yeah, I think with some of the things that I've highlighted with you just now, with getting more specific about our recommendations based on DPPOS or studying rare forms of diabetes, really we're just starting here, getting at the differences and understanding the differences we see in our patients with diabetes. And I think a lot more research could be done to understand those differences. We still know there are problems. People who have diabetes of minority racial and ethnic backgrounds are adversely affected and have higher rates of diabetes, as well as the complications that I've mentioned previously. And we need to have the full picture about why that is and what puts them at the greater risk. And that includes needing studies to understand the health inequities that they face, as well as the differences in social determinants of health that can account for that health disparity. We also have learned so far that youths with diabetes have an adverse course compared to adults. So they have a greater rate of progression with their diabetes and a greater rate of developing complications than adults. And we don't have yet good ways to prevent that. So that's another area. And on the other end of the age spectrum, we were just talking about older adults, we know that that's a very heterogeneous group. And there are some older adults who have not just diabetes, but also the complications I mentioned, the cardiovascular disease, the kidney disease, and they have to take medications for all of those things. While some other older adults just have diabetes and maybe just take the one simple medication like metformin for their diabetes. So we need to understand also how best to tailor care for this broad spectrum of health and disease in the older adult population with diabetes. And so I really think more can be done. And as we move forward with more research to understand those differences, I think we're going to get at better diagnostics, more targeted therapies, and better strategies to prevent and treat diabetes for people in this country. And I look forward to seeing that and contributing to that here at NIDDK.
That's fantastic. I guess I'm hearing you say that instead of the one size fits all approach, we're really moving more towards individualized or personalized care. And that's sort of 2020 and beyond. That's really the goal. Well, you really covered a broad range of very important topics. I think our listeners are going to get a lot from the conversations and from your answers. And so in closing, I just want to thank you for talking with me about diabetes and the many research efforts designed to improve public health among the citizens of this country. Thank you so much, Dr. Lee. I really appreciate it. And thank you.
Thank you.
And for more information, visit us at niddk.nih.gov and search diabetes. You can also follow us at niddk.gov on Twitter, Facebook, and Instagram. I'm Dr. Griffin Rodgers. Thanks for watching.